Ire Owahimere. I am a senior at the Rochester Institute of Technology, where I study electrical engineering. If I were to describe my internship experience this summer in one word, I would pick compelling. The reason why is because, I didn't have too much experience in this field before, but I had always known that medicine was something that involved a lot of people. It's a much different story when you come to a place like this, where you see not just doctors, but engineers as well, all working together for one patient. It changes the way you see the world sometimes, when you think that no one would care, but you actually see that there is a large force behind the scenes working to ensure that that patient gets the greatest care possible. The project that I worked on was the design of an implantable antenna system. When it was initially given to me, it seemed fairly open-ended. And that is one of the interesting aspects of working here. You are presented with projects that have a scope, but are still open-ended, waiting for you essentially to define it. And the way in which we did that was, ask questions, do countless amounts of research, and just test and test and test, compare the results against each other, do more research, and ask more questions. While it seemed like a repetitive cycle, it was incredible seeing the amount of progress that we were able to make from building something that we're barely even exposed to, but being able to work with such highly intelligent individuals around us who just helped to guide us the entire time. That was truly, truly amazing. What surprised me most about my experience at Mayo, I'd go with having to wear a suit and tie, at least a tie, every day. Coming from school where you just kind of roll out of bed and throw on something, go to class, lather, rinse, repeat the next day. Knowing how to properly tie a tie each morning was definitely an interesting skill to acquire. I'm now at the point where I can tie my tie in the dark. It's a strange skill to have, but I have it.